I would like to welcome everybody. My name is Rachel Justice, as you know, and along with Jillian Levinson, we run the Woman to Woman Gynecologic Cancer Support Program. This is part of our ongoing COVID and cancer series, which I can't believe is still going on, to be honest. I thought that this group would be done a long time ago. We wouldn't need the information, but unfortunately, it seems as relevant as ever. Dr. Smith has been with us a few times, and she is, as you will hear, I will read her bio for you, but she is about as leading an authority as there is on the cancer and COVID intersection, and really provides such relevant information. And she is a very, very busy person. So we are so honored and grateful that you are taking the time to be here. So Cardinale Smith, MD, PhD, Associate Professor of Medicine, Hematology and Medical Oncology, Palliative Medicine, and Director of Quality for Cancer Services at Mount Sinai, was one of the top 40 inspirational leaders under 40 by the American Academy of Hospice and Palliative Medicine. That is her very brief bio. She has a bunch of new responsibilities also. And as I said, she is a very busy and very qualified person to be leading this. So we'll turn it over to you, Dr. Smith. And again, we will ask everyone, think of your questions that you want to have answered, and you have come to the right place. So thank you again. And I'm turning the virtual mic over to you.
Sure, thank you. I'm happy to be here again today. It's nice to see you all, even virtually. I didn't want to update the slides. I figured we could just be informal this time. I think, while some things have changed, not too much has changed since the last time I was here. So I thought I would just go through with some of where we stand now, and then we could just go through whatever questions you might have. So as you all know, we currently are in, we're still 2.5 years post the pandemic. Where we currently stand right now is thankfully, due to vaccines, I think we're able to get COVID at a place where things are sort of stably controlled. And although we are certainly seeing new variants that are coming up along the way as a result of COVID, we are not seeing the same levels of hospitalizations as we had seen previously. Certainly not to the level of what we saw in March and April, May of 2020, not what we saw in December of 2020. Or with the Omicron wave of even December of 21. I think people are talking about in the news, a triple threat or something, I don't know. People are calling all different things. I think what's happening is that because over the last winters, when we typically see flu for adults, RSV in children, because prior winters, people have been masking more routinely, we haven't seen as high rates of flu or RSV. I think people also weren't getting their flu shots as routinely as they were likely getting it prior to COVID either. And now what we're seeing is people have started to unmask much more, is that the flu is here, RSV is here, and you have COVID on top of that. And so while there are more rates of respiratory viruses, and you may be hearing about more children being hospitalized with respiratory viruses, this isn't COVID, this is RSV, which is the type of a virus that in particular children get. And because, we've all been masked for a while now, those children have not had exposure to RSV in the same ways as they would have been exposed in the past. And so this is their first real attempt, their immune system at trying to be able to respond to the virus, which is why we're seeing more hospitalizations associated with that. And so for COVID specifically, we now have the new bivalent vaccines that exist. And so what that means is that in addition to targeting sort of the initial type of COVID that was around, it then targets one of the additional more common variants. And both Pfizer and Moderna make that vaccine. And it is certainly recommended that patients, all people, get that bivalent vaccine. In particular, if you have a disease like cancer that compromises your immune system, if you are on any treatment that is compromising your immune system and making you be immunosuppressed, that you definitely get that vaccine. And so that is highly recommended. I do think while it may seem, lots of people are talking about getting back to normal and acting like normal, and it definitely feels like that. I traveled recently, and there was, in the airport and on airplanes, not as many people are using masks as they were using before. I think for someone who has a more compromised immune system, we know although vaccines definitely protect you and definitely decrease your risk of severe illness from COVID-19, you are still at a higher risk of getting sick from COVID-19 than someone that does not have cancer. And so when you are in situations like that, particularly in times when the COVID rates in the community might be higher, it is highly suggested that you continue to use those measures that we know are safe measures, which include masking, include hand hygiene, and doing those things to keep yourself as safe as you can. I think those are the big highlights and updates of what's going on. And now happy to answer any top of mind questions or that you may have.
So actually, I'm wondering a few things. Can you talk about testing? And can you talk about how often people should be testing? I'll share a story just from our own family, which was a very surprising thing that happened. We have in our immediate family someone who's immunocompromised because of cancer treatment, and somebody who has a newborn baby. And we had a family celebration, so we all did routine tests. And my daughter, who was she's 15, completely asymptomatic, tested positive. And she went through, she's all up to date on her vaccines. She's had the most recent one, and she went through her entire quarantine with not one single symptom. If we had not done a routine test, we never, ever would have known. And she would have spread it very likely to the newborn baby, to an older family member, is immunocompromised. So can you just talk about kind of what, especially with the holidays coming up, kind of your thoughts about testing and, and just recommendations and accuracy and all of that?
Yeah. So I think very similar to you. We hosted Thanksgiving at my house, and the folks who came ranged in age from 5 to 88. And so we all did a rapid antigen test in the morning before everybody came over, for the same reasons. Mm-hmm. I mean, thankfully, vaccines work. So your daughter did well and was not symptomatic, and that's great. And had the potential to spread it to others, as you said, and that's really why we test. And so definitely recommend really some of the best mitigation measures that we can do to decrease spread, because there can be people who don't have symptoms at all, but are carriers and can give it to somebody else who then could become symptomatic and ill, depending on their underlying conditions, is before you're going to get together in large gatherings, the morning of, a couple of hours of, everybody test. And a home antigen test is perfectly fine. And the results should be believed. Is anything 100%? Nothing is 100%, but that is as safe as you can be. And so that's highly, highly recommended, particularly for those of you who are, considered to be at higher risk.
And in terms of the home versus, a PCR test that you would get, there are these little pop-up tents all over the entire city. How do you feel about those? We actually had with my daughter, it was kind of odd because she had no symptoms. So I did 2 home tests that were positive. I figured, let me just take her to the tent. And interestingly, they did a rapid test at the tent, which was negative, and then a PCR test, which was positive. But then when I went home, I did 4 more tests on her and they were all positive. So I called the pediatrician and she said, no, they, forget about what they do in the tent, their rapid test is the same. But, can you talk about when there might be this discrepancy and kind of how you would handle that?
Yeah, so any positive test is a positive test. That's just, you should believe it. Even if you repeat it immediately to get a negative test, a positive test, your first positive test is positive, and you start following the isolation guidelines from that moment forward. I think antigen tests are, did they go up far enough in the nose? Was what they were using expired? I think that there are plenty of questions here. The fact that her PCR then came back as positive is, probably proof that something happened with their antigen test. I don't have any problems with using the tents and things like that. I think, again, it goes back to like the nothing is 100%. And I think you just have to, when you go to these places, you just ask, you make sure that they're using, the most up-to-date equipment that you can.
And you mentioned just now that you start kind of the quarantine and that protocol. Would you mind just sharing what the current guidelines are if someone were to test positive?
Yeah, so for someone who is not immunocompromised, the guidelines are that you isolate for 5 days, meaning, stay as much as you can, stay away from others, stay in your home. If you need to be around anyone else in the home, mask up, they mask up, so that you all are protected. And then technically by CDC guidelines, after 5 days, you then can, leave isolation, but for the next 5 days have to remain in the mask whenever you're leaving your home. I think the right thing to do is to test. I tell my patients, and my own family has used a test out strategy. So, after the 5 days, you continue to test, and only when you test negative, then you go back out, because then that means that your viral load is low enough that you are no longer contagious and therefore cannot potentially infect others. For someone who is immunocompromised, however, that period of time is longer. And the reason for that is because virus sheds likely for a longer period of time. And so that period of time is 10 days. So the recommendation for someone who is immunocompromised is 10 days. So you isolate for 10 days before you go out into the world.
And can you define and again, all the women here are either cancer patients or cancer survivors. Can you define immunocompromised? I mean, would they all count even as survivors, if they're if they are out of treatment? Can you just define, what immunocompromised is in this context?
Sure. So someone is considered to be immunocompromised from a cancer perspective if you have a cancer that you are currently receiving immunotherapy or chemotherapy for. That would not necessarily, any form of systemic treatment that you are receiving for that. So I guess I would put targeted therapies in that category too. So if you're receiving a pill for your cancer, if you're receiving anything through the vein for your cancer, if you're receiving radiation therapy for your cancer, you would be considered immunocompromised. There are other non-cancer conditions, of course, that make you immunocompromised as well. I think the other thing that may be applicable to some of you is someone who might be on high-dose steroids would also be considered as immunocompromised.
And would that include, a lot of our gyn-onc patients take a PARP inhibitor? It sounds like that would, and they take them for a long amount of time.
Yeah, that would also. That counts, yeah.
There are a couple questions here in the chat from Janet. Janet, you're welcome to ask them live if you'd like to unmute yourself. And I know you have to leave, so we'll make sure we get those answered before you go. So there are some current treatments recommended
for patients who are at high risk of severe illness from COVID-19. So what that means is anyone who is immunocompromised, anyone who is and anyone who falls into this category of being at risk for needing to be hospitalized if they get COVID-19. So it's people who, the folks underlying illnesses outside of cancer that fall into that would be someone who would be considered to have obesity, diabetes, severe asthma that has required hospitalizations. There are a multitude of other diagnoses. So if you fall into a category of being at high risk for that you could potentially need to be hospitalized if you have COVID-19, then that makes you eligible for treatment. There are essentially two main treatments, and the treatments do lessen the severity of the symptoms and the amount of time that you have COVID-19, and ultimately they decrease your risk for needing to be hospitalized, and they decrease the risk of dying from COVID. The mainstay, the number one, is Paxlovid. So that's a pill that you take for 5 days. There used to be what we call the monoclonal antibody, which is an IV infusion. Unfortunately, with the new variants that exist, that monoclonal antibody is no longer effective. It doesn't target these new variants. So we can no longer give that. There is an antiviral infusion medication that one can get, but you can only get that if you are on medications that prevent you from getting Paxlovid. So the treatment of choice is Paxlovid, but if you are on medications that absolutely prevent you from getting Paxlovid, then you could be considered for this IV antiviral medication that's called remdesivir.
I have a side note to Janet's question. If you are either immunocompromised or you have a known exposure, is there anything that especially, our patients who might be in active treatment should do at that point? Can you just talk a little bit? And I know you talked before about like the time in terms of shedding virus and stuff like that. I've definitely heard that there is like a window that if you're exposed that you may not, if someone does test positive, that it probably is not a high enough viral load. But can you talk about what they should do and, what those windows that are higher risk and not as high risk might be?
Sure. So if you test positive for COVID, we know that the best time to get treatment is within the first 5 days. So any treatment, whether it's going to be that oral pill or that IV medication I talked about, we really want to give it within the sooner the better, but definitely within the first 5 days. We know that within the first 2 days is really the best. So the second you start to feel symptoms, test. I think my children now, the second they start to have a runny nose, they just go downstairs and they get the test and hand it to me right before they go to school in the morning. It's like part of their routine. I think just test. And then you call your doctor and talk about it with them, because they'll really be the best person to guide you on what the most appropriate treatment is. But the sooner you test, then the sooner you find out and the sooner you can start treatment. Less than 5 days, but the sooner the better.
And Angie, I know that Cynthia and Margaret, your hands are up, but Angie has to leave. So let's just jump to her question right now.
So I think it's different depending on what treatments you've had. But in general, depending on the type of treatment you've had, it depends on how long it takes for the last treatments you've had to clear your system. And I would say sort of the longest that is about a month.
Hey, thank you. Thank you, Dr. Smith. I did have a question regarding
Paxlovid.
Paxlovid. Is that FDA approved?
It is, yes.
It is. Okay. And in regard to the immunocompromising situation, would being on, like, say, an inositol or something like that, an inhibitor, is that also compromising the immune system?
Yeah, so, I say in general, the easiest way to remember it is if you're taking a treatment at all, anything you're taking, a pill or an infusion for your cancer, then you could consider yourself immune compromised. I think it does get a bit nuanced. That's a very general, broad statement. And it is different for everybody depending on the state of your cancer. And so really the best person to have that conversation with is the person who's treating you for your cancer.
Seema, in terms of your question, would you like to unmute and ask it directly, or I can read it for you?
So I have the flu now. I went to doctor yesterday. They did a test, the flu test and the COVID, and thank God it's not COVID, it's the flu. So they said it was the second day of the symptoms. They told me I can have, there's a pill that I take only one day, and it doesn't have as much side effect as Tamiflu. When I went to the pharmacy to pick it up, they said they don't have it. They're out of it. So the doctor decided to give me Tamiflu. So the last time I had chemotherapy was 2 weeks ago. I want to know, do I need to stay home for 10 days because I have the flu? Is it like COVID?
It's not. And I think in general, when you have the flu, we say, that you should stay home until, you've had a fever has resolved for 24 hours or more. If you've had a fever. I
didn't have fever. I don't have fever. I have very, very bad runny nose, and I had a little bit of chills and body ache, very minor. It wasn't that bad. Yeah. But what bothered me, the nose was the worst thing. It wouldn't stop coming down. But now, does this pill that they gave me, Tamiflu, interferes with anything? I also have a procedure next Tuesday. There's a stent in the vein that was put there in May, but it closed up. Now they have to open the stent. Do you think I can go ahead and do the procedure with this medication in my body, Tamiflu? Yeah, so I would definitely call the person who's going to be the team that's going to be doing the procedure. I mean, they're going to want to know anyway that you've had the flu, right? Because they're going to want to clear you before you have the procedure and make sure that your symptoms are better and that you're feeling better before they do it. Sure. So that's definitely a conversation that you should have. Yeah, I did tell them. I got in touch with them. I told them that I have the flu now and I'm this medication. I haven't got any response from them, but I should. But it's next Tuesday, and I'll be fine after 5 days. By Friday, I'll be better. So, yeah. I imagine you'll be off the medicine, and it should be fine. Okay, thank you. You should. They're the ones who's going to have to give you that final decision, though. Yeah. Also, I wanted to make sure I don't have to stay home for 10 days. You do not. No. Okay, that's all I wanted to know. Thank you very much. Thank you.
Okay. I want to thank Dr. Smith for being back, because I attended your other Zoom on Woman to Woman and find you very helpful and knowledgeable and a pleasure to listen to. So thank you. So I have two questions. One is about the flu shot. Back in 1994, when I had my first bout with cancer and I was going through chemo, my oncologist at the time told me to get a flu shot. It was the first I had ever had. And after I told him how I reacted to it, when I saw him 3 weeks later, for my next treatment, he told me I had a very bad reaction and I should never take the flu shot again. So in all these years, almost 30 years now, I've never taken a flu shot, nor have I gotten the flu. So now I'm thinking, well, I'm immune compromised. I'm much older. Should I be taking the flu shot when I go to get my updated booster? And people are telling me to do it. And I mentioned it to my oncologist a few weeks ago. And she seemed to say, oh, just take it. Like nobody seems to be taking very seriously the fact that I was told never to have a flu shot again. So I was just wondering if you have an opinion. It's not enough information, I know.
Yeah, it's hard to render an opinion that, I think really the only contraindication that we know about to getting a flu shot is if you have an egg allergy, because of one of the preservatives that they put in the flu shot, is if you have an allergy to eggs, cannot get the flu shot. Outside of that, there's really no known absolute contraindication. And so, without knowing all of the events of what surrounded you getting the flu shot at that time, it is hard to render.
Right. And I had tried many years ago, maybe 10, 12 years ago, to get the records from that doctor, although he's not practicing oncology. So the person who took over his practice let me have all the handwritten, copies of the handwritten files. This is before the computer, obviously, but he never mentioned it in his notes. Mm-hmm. And all I remember is that my arm swelled up and it was very painful and I was feverish. And maybe there were other side effects. I don't remember. It's 30 years ago. So I'm thinking I really should get the flu shot. I'm not allergic to eggs, but I never eat them. Since I'm 7 years old, I hate eggs. Although if it's baked in something, I'll eat it when you can't taste it. But if you like quiche or something like that, I would never touch because you can taste it. Anyway, but I don't think I'm allergic. So I think based on what you're telling me, I should go ahead and take it because I'm afraid of getting sick. Now, my other question is, so thank you for that. My other question is, can you say anything about the Piccolo study?
So, I am not, I do not practice gynecology, oncology as an oncologist. And I think
just breast cancer?
Lung cancer.
Oh, lung cancer. Okay.
Mm-hmm. Yep. And I think that is referring to something in ovarian cancer.
Yes, it is.
Yeah. So I'm not I am not versed in that study.
Okay.
Yeah.
All right. Well, thank you anyway.
You're welcome.
Thanks, Margaret. I'm wondering, it's kind of striking as we're hearing, and everyone turns their cameras on, how many people are sick right now. I would say the majority of people on this Zoom have some sort of non-COVID related symptom. And I know you kind of addressed that in the beginning, but I'm wondering if you could maybe just talk about like immune, boosting techniques, what we can do to maybe, prevent, COVID, as well as, we've heard flu, we've heard cold, I think that it seems, as you said in the beginning, things are kind of going hand in hand. And, if you could just generally talk about what we can do to, stay as healthy as possible.
Yeah. I mean, I think the basic things we can do to stay as healthy as possible are, diet, of course. We say a healthy diet, which sounds great, but what does that really mean in practice? And I think as somebody who, would label herself a chocoholic, I'm probably not the best person. But, I do think that it is everything in moderation, right? I don't think that it is totally giving up of any one thing. But I do think that we know that sort of diets that lean more heavy away from processed foods, right? And more towards diets that are higher in protein, higher in more complex carbohydrates like fruits, good fats like avocado, as opposed to potato chips. Just in moderation, that's really in general a good thing to do, because we know that nutrition does play a really important role with inflammation in our immune system. And when our nutrition is off and we eat poorly, our immune system is off, and that does lead us susceptible to potentially getting more infections. I think that I do think that there's some limited data around the efficacy of, making sure we take our multivitamin every day, right? I think a multivitamin, vitamin C, particularly in the winter months, can be helpful. And then I also think that all of the techniques that we learned during the pandemic, regular hand washing, hand sanitizing, I think, now my kids, we have hand sanitizers in all our cars. And the second we get in the car, everybody's like this. And, I think just getting into the habit of good hand hygiene, especially in the winter months, you touch lots of things that other people have touched. And it's, it's second nature. You touch your face, you don't think about it. I do think masks when you are in public places with many other people, that's how germs spread. If you're traveling on the subway, trains, right? Like those are places, particularly in New York City, where you will be at higher risk of getting viruses. And so masks are another way in which we can decrease our risk. And then I also think, while not necessarily preventing getting the virus, but getting the flu shot, for example, does decrease your risk of how severe it could be if you were to get it. And so I think that's important as well.
That's really helpful. One thing I would say, and I don't know if there's any medical basis to this, but I told you my daughter, got COVID, and it was coming from a run where she had a very busy week at school and she had gotten no sleep. And
Yeah.
I think that part of why, she was so exhausted, and
Sure, sleep and rest are equally as important. That's right.
Related to what I was asking a bit earlier, suppose everyone does test and everyone is negative, and you go to a holiday gathering, say, at someone's home. And then, the next day someone calls and said, oh my God, yesterday I was, fine, but this morning I didn't feel well and I tested positive. I imagine all of us, have been or will be in that situation. So what do you do in that situation? What's kind of your next course of action?
So test, you test, immediately after the exposure, and then again within 3 to 5 days after the exposure. If by day 5 after the exposure you're negative, then it is very likely that you will not become positive from that exposure.
Okay. So was the recommendation, so ideally you test upon learning the news, and then at day 3 and day 5, or
within 3 to 5 days.
Within 3 to 5 days you test, but if by day 5 you are negative. And would the same go, because I think you did reference this before, but I think something that's an issue that a lot of people are having is, if one member of a household tests positive, it's really hard in New York City apartments, and to try and do the best you can, shared bathrooms, shared kitchen spaces, even if the person, hangs out in their room as much as possible, they obviously are going to cross paths. So what do you do in terms of testing if you're living in space with somebody who is positive?
Yeah. Truthfully, I think, I don't think the guidelines don't say this. I will say, if you are, I think it depends on what you're doing. So if you are home too, and your risk of exposing others is low, then I think you can wait until they come off to their 5 days, and then you test. And if you test negative, then you will assume that you are going to be okay, as long as they're still testing negative, right? Because if they're still testing positive, that means that they're still infectious and you can still catch it from them. But if you are going to be going out, in my opinion, I do think that there is a responsibility we all have. And I do think if you have the ability to test daily, that we should. And that's, I know that's what my own family did, right? Because you want to minimize the risk of spreading it to others.
I did. When it comes to the tests, the rapid tests, you mentioned something about when they get outdated. How real is the outdated good until date? Because they're costly, and I have a bunch of them I got a while ago, but I didn't use because I didn't need to. Like, how much can you stretch it, or shouldn't you do that at all?
Yeah, that's a really good question. I was reading something about this, and I wish I could tell you that there was one answer for all of the tests, but because they each make their that solution very differently, there isn't a standard. In general, you can probably go plus minus a couple of weeks, but I wouldn't trust it for more than a month.
Okay, that's good to know. So that means I have to get new ones. Because none of mine I have to check, but most of the ones I got were originals, when they were first available, and then they're outdated. Okay, that's helpful. And the other question I have is, I'm immune compromised, and I'm extremely careful about mitigation. Like even this past Thanksgiving, I was invited over to some friend's house in Manhattan, and I didn't go because the people there all do a lot of unmitigated stuff in their lives, and they're not sick and they tested normal, but I'm still, very concerned. So I actually didn't go, even though I wanted to. So I have a situation coming up tomorrow where I have to meet with a friend in my building in her apartment to do some work together for about an hour. And I went last week to work on this thing with her, and I wore a mask and she did not. She offered to put a mask on, and I told her I didn't think it was necessary, just as long as I wore my, KN95 that fits me without leakage. However, she just came back from California visiting relatives for the holiday, and I'm going to see her tomorrow. So she's been exposed to who knows what on the planes and traveling and her family and blah, blah, blah. So is it going to be safe for me to just wear my mask in the house? Or maybe I shouldn't be I should make a very quick visit?
Yeah, I mean, I think this all goes back to your level of, your level of risk, how risk averse you are. I think
I'm very risk averse.
I think the things that you can do to be as safe as you can is, you can test right before you all meet up with each other. And
Meaning she should test.
I'm sorry?
You mean she should test?
Sure. Yeah. After having traveled.
Right. I could ask her that. But this is not somebody who's a close friend. It's more of an acquaintance in my building, and I feel a little uncomfortable asking her to do that, but I could ask her.
I see.
And I have no need to test because I haven't been with anybody. I didn't even go to Thanksgiving. So
Right.
I know and I have no symptoms. So I can't imagine I have COVID.
Right.
So.
Right. I think testing, masking, and meeting in well-ventilated areas are really the best, the things that you can do to mitigate risk the most.
Right. So the last time I was at her place, it wasn't as cold as it is now, but she did open the window quite a bit for me. So I'm sure she'd do that again. She's a lovely person. So I should ask her to test when, today or tomorrow? I think I'm actually seeing her today. Let me look at my book. Too many things going on. Hold on. I'm seeing her tomorrow on Wednesday. So should I call her and ask her to test today or tomorrow morning or what?
Yeah, you can ask her to test tomorrow morning.
Okay. All right. Well, this is helpful. Thank you.
You're welcome.
Dr. Smith, I have a question also. Do you believe that there are other integrative medicines that you combine with what we're currently going through and the COVID that may be helpful, or that your field of expertise is looking into in terms of treating the whole person going forward with this whole COVID and cancer environment kind of thing?
Yeah, I think outside of things like, vitamins, there aren't any integrative therapies that I am aware of that's currently undergoing investigation or that has been shown to have any additional benefit outside of medical management. And I see the questions here around the testing and how do you get kits and things. Outside of the kits that the federal government had provided kits to everyone through the United States Postal Service, USPS, go online to USPS to request. Each household was able to get two kits. You could make 2 requests per each household, which gave you, I think, 4 tests per request. And then insurance will cover, depending on your insurance. How they cover it is a little bit wonky, because I know it took me a little bit to get my own reimbursement from my own insurance. It was not straightforward at all.
I know, it's funny. It's like I was looking at that. I was like, oh, we can get something. It's like, well, you still have to apply your insurance. It's like, huh?
Yes.
Okay.
Yeah. And I had to pay for it up front and then get reimbursed in the back end. That's the way it worked. Yeah. But outside of that, I don't know, Rachel, if you are aware. I'm not aware of places giving out free kits.
So I think that first of all, any of the tents that you go to, they are willing to see you even if you don't have insurance. I've seen a few of them, and they have you kind of register online, and it just says, do you have insurance, yes or no, and they will still give you a test regardless. So that's different than getting a home test. But in terms of I don't know, Cynthia, where you live, but again, here in Manhattan, there are those tents are everywhere. I mean, they're especially near the subway stations. I've seen that there's quite a lot of them, kind of within a few blocks of the subway. And you can also go online to see where they are. So I think that if you call 311, my understanding is that you can ask, because there are places, they won't give you like a big stack of the tests, but you can go to pickup centers and get a home test to take home with you. And I don't know how often you can do it, but I know that 311 is being advertised as a resource to find out about where you can pick up at-home tests. So I would strongly recommend.
That's a good one. 311. I didn't think about that. Thank you.
You're very welcome.
Thank you. So yeah, I'm like in the middle of just coming. I felt so horrible. It's like flat, but now it's a little bit up on the uprise like today. And I was just shocked that I got it. So for Margaret, I really don't go out that much either. So, I mean, the misconception that you can still be inside and not get it is not necessarily true. You still could get it when you least think you didn't go out, didn't talk to somebody who had it, or it happens. So I was very shocked when after all this time getting it now. So obviously there was somewhere along the way, there was a slip up, and I don't even know, my building, due to come to the vent. I don't know. Is it really airborne? I don't know, doctor, but it happened. Even though I was trying to do my due diligence to be very careful.
Well, I could add, this is Margaret speaking. Right, you don't know where it happens. It could happen, but I also feel we have a responsibility to reduce our risk. Some people have different, like Dr. Smith said, people have different levels of risk. Some of my closest friends have different levels of risk and what they're willing to do. So I've been trying to be as risk-free as possible, but I know you can't totally isolate yourself, especially when you live in a big apartment building like I do, have to ride the elevator, things like that. But I'm sorry to hear that you got it. It's a mystery how. Something we all face.
Absolutely. And Cynthia, I'm just looking online right now, and definitely call 311 because it's saying that they do that. They also, it seems like they're giving out N95 masks too. So not just tests. So you can ask about both. So I'm wondering, in our last few minutes, Dr. Smith, if you could talk, and I know that obviously you don't have a crystal ball, but if you could tell us kind of in the future going forward, what you think COVID might look like in the future. Do you think there will continue to be adjustments to the vaccine? How often do you think people will be offered the vaccine? Again, kind of, this is a question I'm sure nobody can answer, but, do you think there will be a time when we don't need to have this group, when COVID, and cancer, is not as, prevalent a thing? We would just love your thoughts. And again, no one's holding you to this because, as we said, no one has a crystal ball, but I think we'd love to hear your opinions on this.
Yeah. I mean, I think COVID is here to stay. I think it is definitely it's a part now of our, it's endemic, as they say, right? So now it is a part of who we are and how we're going to be moving forward. I think that I'm hopeful that we, that we won't necessarily have to have special meetings to talk about it. But I do think probably at least depending on what happens with new variants, and how we're able to shape some of the newer vaccines so that maybe they're able to cover more of the potential new variants as they come forward. I think particularly for our populations of patients with cancer, we're really going to have to be thinking about having treatments available, just like how we have Tamiflu for the flu, right? We're going to have that Paxlovid like for COVID, and we're going to have to make sure that we have a similar monoclonal antibody that has activity when patients aren't able to take medications like Paxlovid because they have contraindications, so that we're able to treat everybody depending on their level of risk.
I think that is, somewhat depressing, but also hopefully optimistic that what's interesting, I think, for all of us is that we've seen such a big difference, from, 2020 to, the end of 2022. And again, I think at this point, even if not everyone on here has gotten it themselves, at least someone you are close to, has kind of, gotten it. And you hear stories about people like my daughter, who get it with virtually no symptoms. And so the message that I hear certainly from a lot of our healthcare providers is just, if a vaccine is offered to you, take it. So, and in terms of the future of vaccines, what is your, guess for, when the next, for those people who just got the most recent one, when the next one might be offered, and what that might look like?
Yeah, so I think if your most recent one was the bivalent vaccine, then likely I would imagine we wouldn't be talking about another vaccine until next year, sometime, likely fall, when it's time for the next viral season. The only way that would change, I would imagine, would be if there was some new variant that developed that was particularly worrisome or harmful to us, in which we needed to really target sooner. What I imagine happening now is that these vaccines will sort of be more seasonal, like how flu vaccines have become seasonal. And if your most recent vaccine was not the bivalent vaccine, but was, either the third or the fourth dose of the initial vaccine, then I would say everyone should get a bivalent booster. And the general recommendation is to get the bivalent booster at a minimum at least 3 months, to wait until at least 3 months after your last vaccine dose before you get the bivalent booster. And then, like 30 days or so after your most recent COVID infection.
And speaking of recent COVID infections, there's sort of discussion about like how protected you are, after you have it. And is that such a thing? I mean, is it unlikely that you will get COVID again within a certain amount of time or not?
So in general, it's believed that 90 days is the highest period of protection. And that's for the general population. So once you've been infected with COVID, it's believed that the 90 days after that is when you have the highest level of antibodies to COVID, and therefore are the least likely to get infected again. For someone, though, who's immunocompromised, it likely is not that long because your body's immune system is not quite able to create antibodies to the same level as someone who's not immunocompromised. And so that we don't have the answer to.
Well, thank you so much. This was incredibly helpful. I'm so glad. I think everyone was able to participate, and have questions answered. It was really, really interactive. And again, it is a little depressing, that it is multiple times you're back and people still have questions that are as pressing as ever. And we really can't thank you enough for taking the time to share your expertise, your knowledge, your experiences, your opinions, and everything with us. I hope that everyone has a healthy and safe holiday season. And again, we really appreciate you all being here and taking the time. So thank you, Dr. Smith. We really, really appreciate it. And be well, everybody.